You know, a visit to the gynecologist can feel, well, a little mysterious, right? Especially with all those different instruments involved. So in this explainer, we're going to pull back the curtain and demystify the common tools of gynecology so you can feel way more informed and empowered about your own health.
Okay, so let's start with the absolute basics. What even is gynecology? Well, it's the medical specialty that's all about the health of the female reproductive system. We're talking everything from the uterus and ovaries to the breasts. It's completely dedicated to diagnosing and treating any issues that might pop up in these areas.
I mean, you've probably seen that tray of shiny instruments during an exam and wondered, what on earth is all that for? Well, today, we're going to break it all down piece by piece so you know exactly what each one is designed to do.
So here's what we've got on tap. First, we'll decode the field itself. Then we'll look at the tools for examination, dive into diagnostic instruments and procedures, check out instruments for treatment, and finally, we'll wrap up with proactive health and wellness.
All right, let's jump right into Section 1, Decoding Gynecology.
Next up, Section 2, Tools for Examination. These are the fundamental instruments designed to give your doctor that crucial first look.
Okay, this is probably the one tool everyone recognizes, the speculum. And, you know, its job is actually pretty straightforward. It's just used to gently open the vaginal walls, which gives the physician a direct, clear view of the vagina and cervix. It's absolutely essential for a proper pelvic exam.
Now, this might look kind of similar to a speculum, but it has a different job. This is a vaginal retractor. It's designed to give the best possible access and visualization, especially during procedures like repairing a laceration after childbirth. It's all about making sure the doctor has a perfect view to do their work.
All right, on to Section 3, Diagnostic Instruments and Procedures. We're moving beyond just a visual check now and into the tools used for a much deeper investigation.
Now, this little thing might not look like much, but it is incredibly important. It's called an air spatula. Its whole purpose is to collect cell samples from the cervix for a pap smear, a screening test that has literally saved countless lives by drastically reducing deaths from cervical cancer.
And the pap smear itself? It's actually a really quick and simple process. After the speculum is in place, the doctor just uses a tiny brush or a tool like that air spatula to quickly collect a sample of cells. Then, that sample gets sent off to a lab for analysis. It's over in a flash, but it is such a powerful preventative measure.
So what happens if a pap test comes back with some abnormal results? Well, often the next step is something called a colposcopy. And the key thing to remember here is that this isn't a treatment. It's just a way for your doctor to get a much closer look at the cervix and other tissues. And this is the cool piece of equipment they use to do it, the colposcope. The best way to think about it is like a powerful pair of binoculars for your doctor. It's basically a binocular microscope with its own light that stays outside the body, but it gives a hugely magnified view. This lets the doctor spot any areas of concern that would be totally invisible to the naked eye. Okay, so if the doctor sees a suspicious area during the colposcopy, they might need to take a tiny tissue sample, which is called a biopsy. And this tool, a cervical punch biopsy, is often used. It works exactly like a paper hole puncher. No, really. It uses a tiny circular blade to remove a very small piece of tissue that can then be tested. Another really powerful diagnostic tool is the transvaginal ultrasound. This is an internal exam where a small probe, called a transducer, is inserted into the vagina. It uses sound waves to create these incredibly detailed images of your pelvic organs. It's amazing for checking for things like ovarian cysts, fibroids, or polyps.
I know this procedure can sound a little intimidating, so let's walk through it to take the mystery out. The wand-like transducer is covered and lubricated. Then it's gently inserted. It sends out sound waves that bounce off your organs, creating a live picture on a screen. The person doing the scan, the sonographer, will just gently move it around to get a clear picture of all the different areas.
Okay, moving on to Section 4, Instruments for Treatment. We've talked about the tools that find a problem, now let's talk about the tools that help fix it.
So one issue that can come up, especially as women get older, is pelvic organ prolapse. It's basically where organs like the uterus can start to shift downwards. But there's a really effective non-surgical solution, the vaginal pessary. It's a device that's placed into the vagina to provide support and hold everything in the right position.
And as you can see, pessaries come in all sorts of shapes and sizes. You've got the donut, the ring, the gel horn, and that's because, everybody's different. It's all about finding the perfect fit for a patient's individual anatomy and needs.
All right, let's switch gears to another condition called menorrhagia. That's the medical term for menstrual bleeding that's either super heavy or lasts for more than a week.
For women who know they're finished having children, a procedure called endometrial ablation can be a real game changer.
So how does it work? Well, one common method is called balloon thermal ablation, and it's pretty clever. A small, flexible balloon catheter is inserted into the uterus. It's filled with a saline solution, which is then heated up. This heat destroys the uterine lining, the endometrium. After a few minutes, the fluid is taken out, and so is the device. And the result? For most women, it means much, much lighter periods.
And that brings us to our final section, number 5, proactive health and wellness. Because honestly, understanding all these tools is the first step to becoming a truly empowered patient.
You know, a huge part of being proactive about your health is just understanding your own body. That includes knowing the phases of your menstrual cycle, the menstrual, follicular, ovulation, and luteal phases. Knowing this rhythm is so key to being able to spot when something might be a little off.
And to wrap up, let's talk about some really simple, basic care. The advice here is actually super simple. Maintain a healthy lifestyle and just use plain water to clean the external area. And a big don't, avoid douching or using any scented products inside the vagina. They can really mess with its natural, healthy balance.
So there you have it. We've looked at tools for seeing, for diagnosing, and for treating. Hopefully, demystifying these instruments and procedures shows that knowledge really is power when it comes to your health. So the real question I want to leave you with is this. Now that you have this information, how are you going to take charge of your health?